Good afternoon, everyone, and thank you for joining us at our media availability this afternoon. I'd like to once again welcome Dr. Elizabeth Richardson, our Medical Officer of Health, and Paul Johnson, the city's Emergency Operations Director. And before I hand it over to Paul, I'd like to just share a couple of updates. First of all, the Hamilton Winter Fest is making the shift to a virtual festival for obvious reasons, and bringing the community more than 50 unique opportunities to engage online, on a walk, or in your home. So this year's virtual event will take place from January the 29th to February the 15th. I encourage everyone to check out the event's calendar and download the digital magazine packed with ideas for winter fun at hamiltonwinterfest.ca or on your favorite social media platform. And second, the city has launched its 2021 Business Impact and Workplace Needs Survey today, which is a follow-up to the April 2020 COVID Business Impact Survey, which was recommended by the Hamilton Mayor's Task Force on Economic Recovery. We're hoping to reach as many business owners and operators in the community as possible. So please log into the investhamilton.ca site and provide the information that we're looking for so that we can do a good job or a better job of promoting the economic recovery in our community. And lastly, with the disappointing news, on the delay in the vaccine distribution, which is frustrating and unfortunate. I know Dr. Richardson will speak to that. It is important for everyone in our community to still stay vigilant and continuing to follow the guidelines and restrictions set out by the province. We cannot let this setback take us all off course or lose focus. We can't give up. We need to continue to stay at home, limit your outside activity to your home or essential household, wear your mask, wash your hands, keep your distance from others, and if you have any COVID-19 symptoms or are not feeling well, stay isolated at home and get tested. So do your part, trust the experts, and continue to follow all those recommendations from our public health team. And I know our federal and provincial partners are working hard at getting vaccines back into the community so that we can put it into arms as soon as possible. I know that the doctor will let us know what will continue in terms of vaccination and what will not for the short term. And when we get there, she'll share that information with us. But at this point, I'm going to turn it over to our Emergency Operations Center Director, Paul Johnson. Paul.
Thank you very much, Mr. Mayor. And want to begin today talking a little bit about what's happening in this stay-at-home order and lockdown situation that we're in and compliance. And I want to start with a thanks to the community, particularly for our outdoor recreation amenities, in particular our ice rinks. The feedback we received over the weekend was that our ask of the community to wear masks at all times when you're using the outdoor rinks was complied with in great ways, and people were more than willing to understand why we're asking people for that. You know, skating around the skate loops and being involved in ice skating, you can't guarantee that at every moment of every part of that hour that you're on the ice that you may not come within 2 meters. And so people understood why we're asking for that, and the compliance rate was unbelievable. And to those who took the time to thank our staff who are out there managing these rinks and helping people to get on and off the ice and taking care of all of that, the time you took to thank them went a long way. I heard this morning that it was very much appreciated. Yes, they're doing their job and they're happy to do their job, but boy, was it nice to have them hear some thanks from the community about keeping these things open, which is, you know, one of the few areas that people can get out and participate in some organized activity. So great stuff, and keep it up, and please wear the mask if you're booking and coming to any of our outdoor ice rinks. The City of Hamilton, in conjunction with Hamilton Police Services, our bylaw officers are continuing to enforce the stay-at-home orders and all of the other provincial orders and local bylaws that are in effect. As we've reported out, this is not a case where people are being stopped in their cars. People are being, you know, we're not banging on people's front doors and for no particular reason, just checking and making sure people are complying. We are really focused on those things that matter under the Reopening Ontario Act and our city bylaws and some of the emergency measures that are in place. And that is about businesses that are not permitted to be open. That's looking at large indoor gatherings. It's looking at people continuing to have indoor gatherings with people that are outside of their households, those types of things. That's what we're focusing on. And just a reminder to the community that if you do have some complaints, you can call the city number 905-546-CITY or 546-2489. Please do not call 911 to report issues under the Reopening Ontario Act, physical distancing, not mask wearing, indoor gatherings. Those are not emergencies that require you to call 911. Just call the city and we will come out and do what we can. I will say to our business community, it was great to see that only one business showed up this week in our weekly reporting in terms of some of the enforcement that we're doing here locally. And that was a business that was supposed to be closed that had opened and was also charged with some other offenses in terms of mask wearing and not maintaining physical distancing. But the big piece was it shouldn't have been opened in the first place. That's great to see. So thank you to our businesses that are doing their part. We did have to attend to a number of individual calls and late charges, some by the police and some by our bylaw officers around individuals in the community. And some of those were to do with people that were out in the front of City Hall and gathering there. Some were also at private residences. And so it goes back to what Dr. Richardson has been saying before, that remember, the things that we're doing in our social life and our private residences are important. And as we've reported often, they are oftentimes the source of where some of the transmission of this virus has taken place. So, we're continuing to enforce that when we do get complaints, when we do hear of things that are going on and doing that. But from a business community perspective, really excited to see that we had very few of those. I know a lot of things are closed, and so that might have helped the numbers a little bit, but even so, it's nice to see that businesses are complying as much as they possibly can. In terms of the big box store blitz that was announced that the province was undertaking, that is undertaken by the province. We don't have the statistics on that, nor do we publish those on our website. The province takes care of that themselves. And as you could see from the reporting out provincially, they weren't overly thrilled with compliance in general, although maybe not as many charges were laid. The overall compliance wasn't where they want to see it. So my understanding is the province will continue to work with local communities and do some of that work as well. As you will have noticed, if you're following outbreaks in this community, which continue to be a significant challenge that I know Dr. Richardson will touch on in just a second, you'll know that some of those outbreaks have now begun to touch our homeless shelters. And this is a worrying development, and we are doing everything we can to contain those outbreaks, working with public health. I will tell you, we've had a robust system in place working with our emergency shelter providers right from the beginning of this pandemic to deal with issues of COVID-19 within our shelter system that on a nightly basis provides temporary shelter to hundreds of people. So the good news is we do have some of those protocols in place. It is tough to see those numbers grow a little bit in the case, particularly of mission services. And as a result, we are starting to prepare and be ready for the eventuality of having to have more isolation spaces available for individuals who are homeless. And to that end, the Bonetto site, which was, as some people may remember, a rec center that was turned into an isolation shelter early on, it is being readied at the moment so that if we do need it, if we run out of isolation spaces at Wesley, where they're currently housed, that we will have extra spaces available. So all of this is in an exercise, obviously, to keep the spread of the virus down as much as is possible within our shelter system. And you may have heard that some of these shelters that are in outbreak are no longer accepting individuals there. I can assure the public that we have a number of hotel spaces available for folks, and not all our shelters are closed to new entry. So right now we feel our contingencies are working, and we continue to meet daily with our shelter providers to ensure that if anything changes and we need to exercise some other options, we will do so. We mentioned, unfortunately, a very popular activity in the city, which is winter golf. Playing golf at the Chedoke during the winter months has had to be canceled. That's not a decision taken by the city of Hamilton. It's actually required under the provincial order. So we are sorry people can't get out and do winter golf. But to be honest, in the stay at home, it's good to get out, do a little less of that right now and just a little more walking and other types of exercise. If we can get back to winter golf in the future months, we will. But right now, that's closed under provincial order. And the other piece is that some types of construction activities are not permitted to continue. The city's been working with our construction partners around that, but there are no impacts to city construction projects. So sometimes people see city projects happening and may wonder if they should happen or not. The reality is we've gone through those project by project, and none of our city projects fall into the category of those that need to be shut down in terms of work at this point. So I wanted to pass that on to the community. And with that, I will pass things over to Dr. Richardson.
Thanks very much, Paul. Appreciate that. And yes, going to go through some case numbers, some vaccination numbers, and just some other comments about the vaccine. So today we're at 8,219 cases in total, which is up 102 cases from yesterday. And we have 906 active cases in Hamilton. Just want to be clear about those ones, because in the past we've talked about how the backlog has meant that we haven't been able to clear cases and be sure that active case count is correct. Well, I can tell you at this point we are up to date from that perspective, and that is the current number of active cases for Hamilton. So overall, we are at 120 cases per 100,000 population per week, which is good. It is down from where we were. However, it is by no means yet a reason to celebrate or a reason to think that we should change our course in any sort of way. We have had these small waves in the past where we have a slight decline and then unfortunately have seen increases. And so we want to see trends over a longer period of time than we have at current. So we want to see this come down here in Hamilton. And as well, we want to see what happens around the province, because we certainly know we're very much impacted by what happens around us, both in terms of transmission of COVID-19, but also in terms of the impacts on our hospitals and our healthcare system more broadly, in terms of us all sharing the load and making sure that people can be cared for in our hospitals and in our ICUs. We're currently reporting a total of 44 local outbreaks as well. And so while our case numbers have come down slightly, our outbreak numbers continue to rise. So that's a much higher number than we've had in the past. And we have 3 new outbreaks being added today, one at Fantastic Scholars Child Learning Center, one at the Satellite Health Facility on the 2nd floor there, and at the Capability Support Services Thrive Group. And so as always, you can find out more about the outbreaks and other aspects of COVID-19 activity on our website. But I do want to provide you with a bit of an update around the vaccines. As you know, yesterday we were advised that the province is pulling back the number of vaccines that each health unit is going to have in order to because I should say Pfizer has pulled back on their production for now, while they ramp up to get up to a higher level of production going forward. So in the end, that is a good news story in terms of there being more vaccine that is available for us, but in the short term, they are pulling back on their supplies. So we are expecting to receive more supplies in March, but do have to hold back on our vaccination clinics until we get through that. So we are still able to go forward with first doses for residents, staff, and essential caregivers in long-term care homes and high-risk retirement homes as we had planned, and that's on target to be completed by Wednesday. For the first doses. Of course, the second doses need to follow on, and at this point, we believe we are going to have supply to do those on time in those settings, but we're continuing to work with the province. They're trying to get a handle on where all of the inventory is around the province and how they can ensure that that happens for everywhere here in Ontario. So definitely it's disappointing news in the short term, because we had wanted to continue to move forward with the phase 1 sequencing of groups, but we are going to continue with the planning, make sure we have the information that we need in order to be ready to move forward as soon as they allow us to do that. So right now, what's happening is the fixed site is continuing, the fixed site, which is the Hamilton Health Sciences site, it is continuing to provide second doses of vaccine for all those who had come there previously for vaccinations. And through the mobile site clinic, we are going to continue to do vaccinations for long-term care home workers, essential caregivers, and of course, the residents that are there. So at this point, we've administered a total of about 13,400 doses of vaccine and have just begun on the second doses for those that were first immunized back in December. And so we're going to continue to move that forward. So just a reminder as we go forward through this time, as I said earlier, certainly not a time to be changing our tactics around how we're managing this pandemic, and to continue paying attention to public health measures. Those continue to need to be in place, whether you are talking about a long-term care home, retirement home, or you're talking about being at home or going out in the community for essential business. So remembering the gathering limit is in place, and people are asked to stay at home unless there's an absolutely essential reason for leaving the house. It's really important that we stay home and especially work from home wherever possible. I know I continue to hear reasons why perhaps people need to go into the office. I'm not talking about here at the city because it's been very thorough for us, but out and about in the community that there are reasons why people may still be going to work, and reminder that for wherever ever possible, you need to stay home, and employers should be working with their employees to ensure that they can stay home and work from home. Utilize curbside amenities wherever possible. Yes, you can go to a grocery store, but if you pick up your groceries at curbside, that's even better. And let's continue to see the decreases in those numbers as we go forward. Thanks very much, and over to you, Mr. Mayor.
Thank you, Doctor. And sobering news indeed, but something that we have to continue to work at to ensure that we continue to stop the spread of this virus. So even with vaccines in place, and we could consider this a setback, but even with vaccines in place, people are still required to mask and physically distance and all the things that we're requiring now. So from that perspective, we haven't lost any time. What we need to do is get that vaccine to us so that we can vaccinate more people, so that over time we can get to that 70 or 80% margin that will allow us to get to some sense of normalcy. So please continue to conduct your lives the way we need to conduct it right now, which is to stay apart, stay within your own household. Treat these orders as orders, not recommendations or guidelines or suggestions. These are requirements. You need to stay home as much as you can to stop the spread of this virus, and then there will be enforcement whenever we can or wherever we can to ensure that happens. And I do field calls from folks suggesting that people are having guests over to the house, and if that's occurring, feel free to call 905-546-CITY or 546-2489. That's the number to call if you have complaints of people that aren't doing the right thing. Let's hear about them so that we can get on top of them and prevent these things from happening in the first place. So do your part, stay with the recommendations of public health, and hopefully we can break this deadly trend of transmission that we have going on right now. And as the Premier says, stay home, stay safe, and save lives. So don't give up. It's essential that we keep fighting this as much as humanly possible to avoid the spread and save lives. And upwards of 200 folks in our community sadly have lost their lives as a result of this. And our condolences go out to each and every one of them and their families. Tragic and unfortunate and preventable if we all do the right thing. With that, I'm going to hand it over to Jasmine for some media questions. So Jasmine, take it away.
Great, thank you so much, Mr. Mayor. We have 6 media joining us today. First question will be to Desmond from CBC News. Desmond, you can go ahead. And we'll just get you off mute there. Okay, maybe not. We'll go on to the next question to Fallon from the Hamilton Spectator. Fallon, you can go ahead.
Hi there. Thanks for taking my questions today. This would be a question for Paul Johnson. So the business that was charged this week was a hair salon. Those are supposed to have been closed since before Christmas, I believe, when we went into the gray lockdown, if I'm remembering correctly. So can you tell us more about what was happening at that business and I guess how the city was flagged to it being open?
So I don't know how we were flagged to it being open. My only assumption is that generally in these cases, somebody sees activity happening in a business they know should be closed. So you're absolutely right. The business should have been closed. And then you see the additional pieces there. There was obstruction. There was also face covering and physical distancing issues within that. So it's a reminder. Look, we all understand here that businesses are hurting. And we also can understand, people desperate to try and keep themselves afloat. But the reality is we can't have businesses opening that shouldn't be. And it doesn't matter whether it's a hair salon or a restaurant or anything else. And so people need to take heed of the orders that are in place, and if not, you'll find yourself on the other end of our bylaw officers or police. And recognize that there are, also authorities for us to close businesses and things now that are provided to bylaw officers under the Act. It doesn't appear in this case we chose to do that. The owner, I guess, we emptied people out and they agreed to close. But this is obviously one we'll monitor, and it's a warning to businesses that are to be closed. Don't reopen. It's going to be a costly venture for you. And as I say, we do have the power to also close facilities ourselves if we find things that are open. But hopefully that doesn't happen too much. But in this case, we need to take action.
And my follow-up question would be for Dr. Richardson. So in the business, they were obviously fined for, mask wearing and social distancing. And this is a close contact sort of situation in a hair salon. I guess what's the concern with a business like this reopening and then obviously agreeing to shut down? But like, what is the concern with that right now, especially with the high case counts?
So absolutely, this gets back to the reasons why we're in this situation where we need to, unfortunately, take these kinds of measures in order to get transmission under control. I spoke last week about sort of 3 reasons why we were not able to bring the case counts down to date. One was because of stigma associated with it, and so people weren't wanting to talk and tell people that they may have done things that could lead them to be at risk or may have symptoms of COVID-19. Another was some of the structural issues that go on in terms of income and sick days and that sort of thing. And the other one was about choice, about people choosing to go ahead and do things that didn't fit with the guidance. So, we're in a situation where we cannot afford to have people continue to act in ways that lead to increasing risk of transmission. And unfortunately, a number of the things that you heard about related to these charges are those kinds of behaviors that exactly will lead to increased risk of transmission, especially in that kind of setting. And so disappointing to say the least. It's the reason why we have those bylaws and all of the legislation in place in order to stop those kinds of things. And grateful to my colleagues that they're out there enforcing those bylaws.
Great, thank you, Dr. Richardson. Next question to Joanna from the Hamilton Spectator. Joanna, you can go ahead.
Hi, thanks so much for taking my question. I'm not actually sure if my first question would be best to Mayor Eisenberger or Dr. Richardson, so I'll let you decide. But Hamilton has been left out of another provincial hotspot announcement today, this time for hospital surge beds. So I'm looking to find out if you have any thoughts on, why this keeps happening and what it will mean for us to not get these surge beds announced today.
Sorry, Doc, I think you should take this one.
Hi, thanks, Mr. Mayor. Joanna, this is one of the challenges as we go forward. This isn't an announcement I've had a chance to take a look at and review and look at it in the greater context. Certainly, as we are considering these issues, we know we're already taking on additional cases from areas that have higher case counts in their ICUs and in those areas. And so to that end, in terms of people being able to stay in the areas where they are coming from, that is a good thing. That they're closer by family, they're closer by for those sorts of purposes. But overall, when we're looking at all of the issues that are being examined, whether it's around shelters, whether it's around how to deal with different situations, it would be very helpful for us to all be participating in some of these pilots and looking at some of these issues so that they can be informed with some diverse sort of experience around the province. So I think in particular around the beds, that's an issue that's being looked at province-wide, and there may be some areas that need some more acutely than others. But overall, absolutely want to see that we're all able to move forward together.
Thanks so much. And my next question is also for you, Dr. Richardson. According to the last statistics that we've seen, we have almost as many hospital workers vaccinated as long-term care workers. Can you talk about how that has happened when long-term care is supposed to be the priority for vaccination?
Thanks very much, Joanna. Just to clarify, when we talk about the other group, other than the long-term care workers, it is healthcare workers. the priority that was first announced by the province back in December when we first started doing clinics was to do the first two groups, the long-term care home workers and retirement home workers, high-risk retirement home workers and essential caregivers, as well as looking at healthcare workers. And so the hospital, when it received the vaccine, started looking at how it could move forward with those. And of course, in the early days too, as we were gaining experience with the vaccine, understanding, how it could be thawed and how many doses would come from a vial and all those sorts of things, it was very much encouraged and continues to be encouraged that not a single dose gets wasted. And so if there were extra doses, and we have found that we do get some extra doses out of the vials, then they were going in the arms of people who were on standby to come down and be vaccinated. We know for sure our frontline healthcare workers, particularly in our COVID units, our ICUs, that they're at higher risk of exposure, of course, to COVID-19. And of course, we've had several outbreaks in our hospitals because of COVID-19. And so that is the reason why those pieces went ahead. And then when we were able to make Pfizer mobile, we've worked with the hospitals to get out to get those clinics going. And now that we unfortunately have this shortage, that is the only group that's going forward.
Thanks, Dr. Richardson. Next question is to Maria from the Hamilton Spectator. Maria, you can go ahead. And we'll just get you off of mute there, Maria. Okay, looks like, oh, maybe there you are.
Oh, okay. Hope you can hear me. I wanted to ask vaccine hesitancy, Dr. Richardson, if you're hearing anything about vaccine hesitancy among local long-term care and retirement home workers, including agency staff, as well as what's being done to address possible barriers to accessing vaccines, such as transportation or getting time off work to consult a doctor, as well as, in this workforce being made up of a large number of racialized Canadians, is there access to information in languages other than English for those who would like to have questions answered?
Dr. Richardson, we just have you on mute there.
Sorry, I was just saying, Maria, I think it might have been my system that hung up there for a moment, but I missed the first part of your question.
Sure, I can repeat it for you if it's helpful. So I was just asking about vaccine hesitancy among local long-term care workers and retirement home staff. If you've been hearing any concerns about that, whether if there's anything being done to address barriers in terms of getting transportation to the clinics or time off work to consult a doctor before proceeding with the vaccine, as well as access to information other than English for those for whom that may not be their first language.
Thanks, Maria, for doing that. I appreciate that. So when we're looking at vaccination information for our long-term care workers, they, like all of us, they want to be well informed before they go ahead for any vaccine. And that's something that we all should do around our healthcare, is make sure we have the information that we need in order to move forward. Make sure we're consulting with, scientifically credible sources of information. And that's why we put up the COVID-19 vaccine website, so that people know there's a source of information they can go to that collects together that information, has links to other agencies that do have it. So right early days when we started working with the long-term care homes, we made sure to put together information around some things they might be concerned about, what they might be wanting to know about, and had that out to them right off the get-go, along with other sources of information that are out there. So we've been working with them. I'm actually very pleased. We were up over 65% vaccine coverage as of the end of last week. I'd have to recalculate the numbers this week. And so I think we're moving forward really quite well in terms of having our long-term care home and high-risk retirement home workers vaccinated. And certainly as we go out and do the vaccine clinics in the long-term care homes, that will help as well in terms of making sure that it's accessible to people. So we've been asking the long-term care home and high-risk retirement home organizations to work with their workers to try and make sure that they can come into clinics if they're not working on a particular day. So we've been doing all of that. Certainly the language issues are something we've all been concerned about, and trying to work together across the province to get things translated into additional languages, because just as you say, these are workers that are often don't have English as their first language. So it's been a little slower than we would have liked on that front to move forward on that piece. But yeah, you're right. That's absolutely something that we need.
Thank you very much. And my follow-up question is about if you can just shed some light on the process for a long-term care worker or retirement home worker to receive the vaccine, including for agency staff, like who do they give their name to and what happens next from there and how much notice are they given before receiving the vaccine?
Thanks, Maria. So they do work with the home that they work in terms of getting their names on the list, and then those are coming through to ourselves, and we're working then with Hamilton Health Sciences, who is doing all of the bookings to get them in. And so we're just always looking to improve that process, see if there's any changes that need to be made. Hopefully, we are going to have our online system that St. Joseph's Hospital has been working with us on up and running within the next couple of weeks. So that is something that will be good about this particular pause, is we can get that up and running and make it easier for people to access and book in themselves. But that's the process that they're working through right now.
Great, thanks, Dr. Richardson. Next question to Katrina from the Hamilton Spectator. Katrina, you can go ahead.
Thanks very much. I think both my questions are for Dr. Richardson. The first one, I'm wondering if we have enough vaccines right now, if Hamilton has enough vaccines to give everyone their second doses and those who are eligible their first doses. And if we don't, are we expecting to get that amount over the next month?
Thanks, Katrina. So in terms of whether or not we have them in hand in the storage freezers right at the moment, no, they're not all in the storage freezers at this point in time, although a good number of them are. So that vaccine supply will be coming in over the following weeks, but at a much reduced rate from what was anticipated earlier.
Thank you. And are you able to say how many we do have right now that haven't been used?
No, Katrina, I don't know that piece. I do have the number that we've been vaccinated. I know where we are at overall, but I don't know what's in the freezers at the moment.
Great, thank you, Dr. Richardson. Next question to Matt Ingram from CHCH. Matt, you can go ahead. And Matt, we'll just get you off mute.
Thanks for taking my question. Just following up on what Katrina was asking, are we keeping track of how many vaccines are available in the freezers for giving out? And if you don't have that information, Dr. Richardson, who would?
Thanks very much, Matt. So yes, we are absolutely keeping track of it. I just don't have those numbers with me at the moment. I have the numbers in terms of number vaccinated. In terms of getting the numbers, the province has asked, as we've talked about with you, with the larger group of media over the last couple of weeks, the province has asked to be the group that discloses that particular piece of information. And I think particularly as we move forward, as they're trying to look at moving things around, they really are the best people to talk to in terms of how the distribution system's working.
Thank you very much. My other question is for Paul Johnson. Sir, I'm sorry I missed your part of the presentation, so you may have gone over this, but I was wondering, could you tell me about the big box enforcement action this weekend, if any stores in Hamilton were targeted, and what role bylaw had to play in this weekend's action?
Sure, yes, we were actually absolutely part of the blitz, but it was provincially driven. And so it's provincial enforcement officers that were part of it. Of course, our bylaw officers can't attend those calls, but in terms of the provincially announced, and I know there's been some follow-up media around that today from the province perspective, they hold those numbers. So in the cases of what the province was doing, we don't have those data points. And to be honest, I did hear a bit of an interview. They are not going to release the names of the stores that they did charge. They're waiting for the whole process to work through before they would name stores. But they would have some numbers. And if we do receive a summary of those, we'll make those available. But as of the time coming onto this call, I didn't have those numbers available to me. And as I say, the province was handling that. And I understand they're going to continue to do this throughout the lockdown and the stay-at-home orders. These, I think I very much agree, and that's why we're taking the approach we are. Those businesses that are open today is very much a privilege. They are essential businesses that must be open so that we can continue to access the things we need on a daily basis or weekly basis. And so it is really critically important. And whether it's our bylaw officers, whether it's police officers, or whether it's provincial enforcement officers coming out, it's critically important that these businesses take that responsibility very, very seriously. They deliver essential services and essential goods to the community, and we expect them to be delivered in as safe a way as possible.
Great, thank you, Paul. We do have a bit more time left, so we'll go through one more time. I'll start with Fallon from the Hamilton Spectator. Fallon, if you would like another question, you can go ahead.
Yeah, just going back to the charges against that business, obstruction of investigation. Can you tell us a bit about what that means? I think this is a question for Paul.
So that's anything that businesses or individuals may do to stop us from discharging our actions of enforcement. So I don't know in this case what that obstruction looks like, but again, it's just stopping us from being able to do what we need to do. And so, and I'll use an example not from this case because I don't know all the details in this case, but it could be, being very unwilling to present information that we need and that we are entitled to when we arrive. It may be not allowing people to enter into establishment, those types of things. So, when our bylaw officers arrive, they have the right to be there and they have the right to do certain things, no different than the police and no different than on the weekend, the provincial enforcement folks. And so there is the provision to say that you must comply with that. And again, the complying is, we're there to do certain things, let us know what's going on, and then we can make our determinations as to whether charges or tickets are to be issued. And again, these have not all been proven. People can take us on and say that they didn't agree with that. So these are charges laid, not necessarily convictions for those things. But in the case of the obstruction, again, my advice is that to just work with our officers. It does you no good really at the end of the day to stop us from doing what we need to do. And in this case, I'm pretty convinced that the business owner would have known that they're not supposed to be open. This is not a gray area business. This is not a gray area activity. Personal services like hairdressers, barbers, those types of things. This is not something new. It happened, in the Christmas time frame when we went into the lockdown before Christmas and the holiday season, and this business should have known better.
Thanks, Paul. We'll go next to Joanna from the Hamilton Spectator. Joanna, you can go ahead.
Hi, thanks so much for the extra question. My question is for Dr. Richardson. I was looking to see if you can provide us with a breakdown of those 13,400 doses, what percentage have gone or how many have gone to hospital staff, long-term care staff, long-term care residents, that type of thing.
Thanks, Joanna. I can give you some breakdown and we'll follow up. I'll ask Jack to follow up with an email to you in terms of specifics. The challenge is that the system that we're using, that the province has put in place, doesn't give us the breakdowns, doesn't collect the information in terms of residents versus staff when we're in the homes and whatnot. So it's actually very challenging. We don't have the staff to do the paper counts and paper-based follow-up. So we can give you some of those breakdowns. I think as the province improves the system, that'll get better and better. But at this point, there's only so far we can take that. So we'll follow up with you.
Thanks, Dr. Richardson. We'll go back to Maria from the Hamilton Spectator. Maria, you can go ahead.
Hi, thanks for the extra question. I apologize if this has been asked already, but I was wondering if Hamilton will be able to continue with its original plan of after Wednesday, taking on the next step of vaccinating non-high risk retirement homes.
Hi, Maria. No, unfortunately not. So the only first doses that will go forward are ones for the long-term care homes and high-risk retirement homes. Any of the other plans that we had put in place, which was specifically to go forward with all of the retirement homes, those have had to be put on pause. And so we'll continue to do the work to understand and be ready for that. And as I said, we're working hard on this system that can help us with it, but that'll be put on pause until the ministry gets confirmation of additional supply that is coming forward. And of course, at that point, we'll also, as we've talked about in the past, the province has been highly directive around where it wants doses to go. And so we'll also be working with the priorities that are expressed by the province at that time.
Thanks, Dr. Richardson. We'll go next to Katrina from the Hamilton Spectator. Katrina, you can go ahead.
Thanks very much. I'm wondering if this announcement about not giving first doses to anyone outside of long-term care, high-risk retirement homes, is that effective as of right now? Or I'm imagining if it's not, there must be a scramble in hospitals for people to try and get that first dose.
Hi, Katrina. It was actually effective on Monday morning. And so, well, as of the end of the day, Sunday, we had the meeting with the province on Sunday afternoon, and that was the last day that any other first doses were given out.
Thanks, Dr. Richardson. Next question to Matt Ingram from CHCH. Matt, you can go ahead.
Thanks so much for taking my question. I appreciate that. Dr. Richardson, forgive me, you may have said this earlier. I did join a bit late, but I am curious if you can say if there's going to be any impact on health by this delay in vaccination. Are you concerned that this is going to be impactful for people, could lead to people dying of COVID because they didn't get their vaccination in time?
Yeah, thanks very much, Matt. And indeed, the mayor actually spoke about this at the beginning of the meeting to talk about, the vaccine really has been a bright spot in terms of us moving forward. We do know that it is protective against people getting severe disease. We're still learning more about whether it helps us with transmission and exactly how it will behave once it's out there and working in the real world. And as we understand the virus as it moves forward as well. So absolutely, though, we do expect this slowdown to have some impact in terms of delaying us to move forward with our vaccination programs. And so that's why it is important that we continue to focus on those who are at highest risk. That's why the province is making sure that those that are at highest risk of dying from this disease are the ones that are definitely going to get these first doses of vaccine. And then, we can hope to continue to move forward with others at high risk, like those in retirement homes, like those who are over age 70, and those healthcare workers who are on the front lines dealing with COVID.
Thank you.
Thanks, Dr. Richardson. Mr. Mayor, that's the end of our media questions for today. So I will pass things back to you for some closing remarks.
Okay, thank you all for your participation this afternoon, and thank you to the media for joining us, and Bill Custers and the entire team at Cable 14, as well as Clear Cable, all of which help us ensure these availabilities run as smoothly as they do, and thank you so much. And a reminder again, just to please stay home unless you require essential products or services like work or food or fuel for the car. Beyond that, the more you stay within your own household, the better off we're going to be, and the quicker that we can get to some openness in our community and keep the virus at bay. So please don't give up. We need to fight through this, and we need to do it collectively, and we want everyone to participate, not just some. And so when we hear of folks that are not doing the right thing, you're really being selfish and doing a great disservice to our community and to your friends and citizens and family members in your community, where you're potentially putting them at risk and yourselves at risk of spreading this disease and bringing it to others that could potentially die from that. So don't do it. Take advantage of all the resources that are out there to support businesses and individuals in our communities. And I know that some additional resources were provided just recently, $20,000 grant for businesses to be able to continue on. That should be a great assist for many, especially the small businesses that are struggling. So take advantage of those grants on behalf of the provincial government, and do everything you can to keep yourselves afloat, but not put other people at risk by being open. If you know someone you would like more information, or you would like more information on COVID-19 and our response, please visit the hamilton.ca/coronavirus website. And a reminder again that if you have a complaint or you want to share some information about people not doing the right thing, it's 905-546-2489. Call that number, and we will have someone react to that and hopefully prevent whatever is inappropriate that's going on. Our next media availability will be January the 25th at 3 p.m. So look forward to talking to you then. Thank you all very much. We'll see you soon.